So someone wanted to know about Corectopia, and Corectopia means their pupil is not round. So normally the pupils are equal, round, reactive to light and accommodation. That's Perla. Even though I hate using Perla, it is a measure of Corectopia or the absence of Corectopia. So in a Corectopic pupil, it's not round. So it's like oval or some other shape. The most common cause of that is something's wrong with your iris. So either you have iris damage, or you had herpes in your eye, or you had surgery, or you had trauma and sphincter tear. So anything that damages the iris itself will cause an correctopia, an irregularly shaped iris. However, there are neurogenic causes of the iris to be abnormally shaped. The most common is Addy's tonic pupil, because Addy's tonic pupil is a sector palsy. So it affects one sector more. It can be diffuse, but if that one sector is affected more, then you'll get vermiform movements, worm-like movements in the normal segments, but the sector that's involved won't move, and so it'll may be an irregularly shaped pupil. And that is one form of neurogenic pupil. The reason that's important is third nerve palsy almost never produces an irregular pupil because it's neurogenic, but not sector neurogenic palsy. So it's usually the pupil is just bigger. So when it's bigger, non-reactive to light, and regular, that's the one that really you should be worried about the third nerve palsy. And if you have ptosis and motility deficit, if there's no ptosis and no motility deficit, and it's just an irregular pupil, that's way more likely to be something wrong with the iris, trauma, surgery, zoster, or Addy's tonic pupil. And the same for pharmacologic dilation. Normally when pharmacologic dilated pupils occur, the pupil is big, but all the segments expand the same because they're all responding to the atropine or scopolamine or whatever is in there. So when it's sector palsy, it's really not likely to be pharmacologic agent. It's way more likely to be Addy's or the iris itself. And that means you got to do a slit lamp examination on this person, because sometimes there's something holding the iris down from inflammation, like posterior synechia. So the iris can be abnormal because it can't move because it's stuck. And so uveitis, iris trauma, all those things can be seen, but you need to do a slit lamp examination on that person. And then some people have this neurogenic, but it's episodic. And that thing's called the benign episodic pupillary dilation, most commonly associated with migraine. And when it's sector, we call it the tadpole pupil because it looks like a tadpole. So instead of being a round pupil, it's like looks like a little tadpole. So the benign episodic pupillary dilation with the corectopic iris irregularity, no ptosis, no motility, normal slit lamp examination, tadpole pupil. So you need to know that some people are born like this, and sometimes their pupil is like this because they're missing a piece of their pupil. And so if you're born with something wrong with your iris and it's missing, that thing's called a coloboma. And it sometimes looks like a keyhole, like you can put a key there. And it's usually inferior like this because the last portion of the eye to close is the bottom portion from embryology. So you could have a structural abnormality that you were born with, coloboma, or an acquired abnormality from uveitis, inflammation, infection, trauma, surgery, a neurogenic acquired Addy's tonic pupil, or benign episodic tadpole pupil. But almost never is this going to be third nerve palsy or pharmacologic dilation.